If your child snores, there are several possible reasons, and there are treatments available to help with this problem. We spoke with Dr. Paul Lubinsky of Children's Hospital of Orange County, who explains the reasons children snore and what he recommends for treatment.
Quite a few children snore. I mean, for a lot of them it's normal, so about 25% of all kids will snore. But the real issue is those that have obstructive sleep apnea associated with the snoring, which is more a disease that people think about when they talk about adults having obstructive sleep apnea. If they've got a child that snores, they ought to have them checked out. So they ought to see their pediatrician, discuss it. There's been a lot of education about this over the last few years, so most pediatricians are tuned into that, and family practitioners, and will ask about snoring and work their way through that. So for, as I said, about 25% of kids snore, and of those, about 3% will have some abnormality associated with that snoring. There are certainly children who will present with a history of snoring. You want to examine them, see what the issues are. There's a strong correlation with obesity, particularly with the epidemic we have now with obese children. By far the commonest association I have is just enlarged tonsils and adenoids, what we call tonsilloadenoidal hypertrophy. That doesn't always produce obstructive sleep apnea or even snoring, and we certainly see kids with what we call kissing tonsils, where they touch in the midline, and those kids breathe fine and don't have any problems, where others do. To treat the patient, usually the first line is going to be what we call a TNA, tonsillectomy and adenoidectomy. So by removing the excess tissue in their oropharynx, hopefully we can open up their airway sufficiently enough for them to be able to breathe. The bigger problem we're facing these days are the obese kids, and obesity is a very difficult problem to care for. It's an unusual symptom that's often missed. So again, when you're asleep, your respiratory muscles don't work as efficiently, you're lying on your back. Particularly if you went to bed with a full stomach, it pushes up on your diaphragms. And so while these kids are trying to breathe asleep, they've got to use a lot more effort in order to be able to breathe. And they really need to lose weight. TNAs often don't work as well for those kids. Certainly you look for other abnormalities, and there are a lot of new procedures that can be done for a lot of those things. So children who have small jaws, what we call micrognathia, is a small chin, those can be brought forward now using plastics and can significantly improve this problem. And there are a lot of syndromes, Pierre bands, some of the genetic diseases that will produce airway obstruction as well. So those kids we recognize pretty early on and can definitely help out. For the others, the TNA will work most of the time. There's also CPAP or BiPAP, which are masks that fit on the face and then you breathe with them at night. Certainly if you look at your child while they're snoring and you think they were having respiratory pauses during their sleep, then you need to go in as soon as possible. It doesn't mean it has to be today, but you need to call, make an appointment, and go in. And there's some people who have complete obstruction and stop breathing. There are others who have a relative obstruction, and you'll see periods where it just seems harder to breathe. So they don't completely obstruct, but they're just not getting enough in, and their muscles are retracting, and you see retractions in under their ribs. And go in, see your physician. There's certain tests that they can do. They'll want to get a good history about sleep. Other things, if there are behavioral changes, school issues, those kind of things will be clues that a workup's needed. And usually the first part of that workup is going to be a polysomnogram, where you're actually going to do a sleep study and see how much obstruction occurs. The vast majority of kids, it's a cure once you make the diagnosis, work out what you're going to do about it.